And now, on Esoteric Cliffnotes, we have The Phoenix Protocol by Alex Dunning. Before we dive in, let me just say that anything I read from this book, anything you take away from this book, do not take it as any kind of personal, dietary, or health recommendation. You are responsible for your own life and the decisions that you make in it. Consult a doctor if you'd like, but you're responsible for your own actions. This is just me reading excerpts from a book. Do not take any of this as advice or as recommendations. All right, now let's get into it. Introduction. Hippocrates observed in 400 BC that illness continues as long as food is administered. No one ever stops to ask if eating prevents healing. The Phoenix Protocol employs dry fasting for two unique outcomes: rapid healing and its ability to activate adult stem cells. Chapter 1. Beneficial stress. Nothing in there. Chapter 2. Dry fasting. A soft dry fast allows you to come into contact with water such as bathing, washing your hands and face, but not swallowing any water. A hard dry fast requires no contact with any water whatsoever. This type of fasting is not recommended. The body has the ability to make its own water, endogenous water, during the transformation of fatty acids stored in adipose tissue into ATP. And there's a lot of scientific terms in here I have to tell y'all, so just bear with me. Bathing is recommended and takes advantage of the skin's ability to absorb water and a type of counterflow into the skin. This method improves the ability of the body to flush toxins out of the extracellular matrix into the lymphatic system without gastrointestinal tract involvement. When liver glycogen runs out early in a fast, blood sugar levels drop as well as insulin levels. When insulin levels run low, it creates a stress response in beta cells of the pancreas that signals alpha cells to secrete glucagon. Glucagon also stimulates the pituitary gland to secrete growth hormone to slow muscle tissue loss at the same time. And once again, from the reader, just bear with me here. There's also some Roman letters in here, and it's been more than a decade since I've been in a math class, so just, again, bear with me. Fat cells provide fatty acids that are transformed into your own water, endogenous water. That's why you're not thirsty on a dry fast. During the first 2 days of a dry fast, urine output is lower because glycogen in the liver is being used to produce glucose for metabolism. The urine output is greater during days 3 to 6 when the body is in ketosis. Drinking water during fasting prevents endogenous water synthesis because fat cells are not stimulated to release glycerol and fatty acids for glucose and water. The blood never concentrates. This forces the body to use glucogenesis to make glucose from muscle protein. This violates the second cardinal rule, to protect the muscle mass. Drinking water feeds bacteria, viruses, and parasites. Every form of life requires water, including bacteria, viruses, and parasites. Pathogenic organisms can't make their own water, and as a result, they are eliminated by day 5 of a dry fast. By the second day of a dry fast, most of this water production has been eliminated via the urine, and this loss represents water weight of about 3 pounds per day. On the third day of a dry fast, the body runs out of glycogen and starts converting fat in fat cells to energy and water. From that point on, the weight that's lost is fat. The detoxification process during a dry fast goes mostly unnoticed because the body is eliminating toxins the way it was designed. You don't experience the withdrawal symptoms from caffeine or the detox reactions with dry fasting that are typical with dry fasting. Chapter 3. Water fasting. Instead of protecting muscle mass loss, growth hormone is used for finding fuel. This results in the loss of vital body mass protein as urea production rates increase. And this chart, they have this chart with kind of the amount increasing by day. This chart shows cumulative vital body mass loss over the same period of time. The longer a person stays on a water fast, the more vital body mass is lost and the higher the risk of mortality. The loss of tissue from vital organs in some cases is irreversible and you risk heart failure. Chapter 4, Autophagy, Cellular Housekeeping. And here is a quote, an ancient Babylonian proverb from 2200 BC. Cleanliness is next to godliness, and gods are immortal. On the third day of a dry fast, bone marrow stem cells are stimulated to produce monocytes to create macrophages. It takes at least 3 days of dry fasting to activate the level of autophagy to replace these worn-out organelles. Macroautophagy and microautophagy are activated as early as 30 minutes into starvation and remain highly active for at least 4 to 8 hours. It's the night crew turned on during sleep. If the starvation state persists for more than 10 hours, the cells switch to chaperone-mediated autophagy. It's the demolition and rebuilding crew. CMA is known to become aggressively active at approximately 36 hours into fasting and remains at these levels until day 6 or until the body is brought out of starvation stress. Chapter 5, Sirtuins and Viral Infection. Dry fasting is not advised during a viral infection, and in fact, it can make it worse. Dry fasting upregulates NAD+ synthesis, and NAD+ is essential for activating sirtuins before you get sick. Young people generally have more NAD. Chapter 6, The Doctors Who Perfected Dry Fasting. Extreme remedies are appropriate for extreme diseases. Hippocrates. Dr. Chenikov tested the technique on himself first. He repeatedly performed 7 and 10-day dry fasts, and even experimented with a 21-day dry fast. Through his research and supervising dry fasts on thousands of patients, he discovered that an 11-day dry fast is the optimal length of time to cure all conditions, and that no further health benefits are achieved by fasting longer. He recommends that during the fast to change the regime of the day somewhat, to walk at night to fill the body with moisture from the air. Baths are also needed, and their duration can be very significant since the body starts sucking water through the skin, creating a kind of counterflow of liquid into the body. It is advisable to start with a 1-day dry fast lasting 24 to 46 hours once a week. Over the next 2 or 3 months, you can increase the duration to 3 to 5 days. As little as a drop of water taken into the mouth violates abstinence. During the abstinence, save energy, do not waste it on conversations. By the 4th day, reactions to dry fasting become evident. Blood pressure drops, and the body temperature may rise. This is physiologically normal during the healing abstinence. Chills or fever may occur. By the 7th to 8th day, there is usually a bad taste in the mouth, a coating on the tongue, and a bad smell on the tongue to keep the mouth closed. The pulse rate may increase to 120 or drop to 40 beats per minute. In some cases, nausea, dizziness, weakness, accumulation of saliva, irritation in the throat, or diarrhea is observed. Despite the fact that all these symptoms are unpleasant, they do not pose any danger. Conditions result of the dry fasting: improves metabolism, dissolves stones in the kidneys and gallbladder, stage 3 and 4 cancers, acute renal failure, cerebral palsy, bronchial asthma, epilepsy, grade 3 heart failure. On day 5, walk outside in cold air in light clothing or even without it in any weather. If there is snow, you can walk it barefoot. Day 6, try to move more. Avoid sudden movements. Do not lie down, except for short-term sleep during the day. Ventilate the room more often. Go outside in any weather and temperature. It is better during rain or fog, since moisture at this time is consumed through breathing and condenses in the nose. Day 7, urine becomes a dark brown color as the body flushes out poisons. Day 8, entering the second acidosis crisis. Usually there's a bad taste in the mouth and a bad smell in the tongue, but you cannot open your mouth. The pulse may increase. Despite the fact that all these symptoms are unpleasant, they do not pose any danger. Movements should be slowed to avoid high blood pressure. Pain continues in the weakest, sickest organs, which is the result of the process of their healing. Day 9. The movement of fracture. Women can begin menstruation regardless of age and cycle. Coldness of hands and feet is observed. The soles of the feet and palms whiten. Heart palpitation is increasing. In some cases, the pulse may not be audible, but you should be scared as it should be so. But you should not be scared as it should be so. Fasting the body triples its production and release of stem cells, an effect that lasts for several months. It turns out that the regular practice of dry fasting can extend life and youth by 15 to 25 years. During dry fasting, metabolism changes fundamentally in 3 stages. 1. Psychological hunger passes in 1 day. 2. On the 3rd day, the body's metabolism enters a ketoacidotic state to perform cleansing and pathogenic healing. 3. Between the 9th and 11th day, there is a second ketoacidotic crisis, which performs chronic disease healing. Endogenic water synthesized by the body is free from external negative information. Without the impact of negative information held in external exogenic water, blood and lymph are purified intensively through a sort of internal filtration process. There is no need to combine dry fasting with enemas, saunas, and other hydrotherapeutic procedures. The use of these supplemental treatments is not recommended. Since 90% of fat cells are water in the form of fatty acids, they disintegrate 3 to 4 times faster than muscle cells during dry fasting because they represent a higher caloric value as fuel. The experiments by Professor Y.S. Nikolayev on white rats demonstrated that animals subjected to dry fasting after exposure to radiation are far less likely to develop blood cancer than the other rats. The first group, inoculated before fasting, had a 50% survival rate, and the second group, inoculated during fasting, had a 66% survival rate. The third group were inoculated where inoculation took place after breaking the fast. There was a 100% survival rate. Dry fasting involves spiritual work and provides spiritual results that are equally astonishing. Negative information is removed, negative energy is eliminated, energy channels are cleansed, and chakras are opened. The blood draws energy from its surroundings. The purification of chakra energy channels during dry fasting allows a person to receive energy from the environment freely. 4 to 5 hours of sleep is enough. A person becomes highly productive and feels alive, optimistic, and energized. Conditions resolved with dry fasting: ovarian cysts, infertility, parasite infection, viral infection, gangrene, herniated disc, brain injury, stomach ulcer, pancreatitis, and there's tons more, but I'm not going to read all of them. Chapter 7. We can win a losing battle. About 20 years ago, we found a set of genes that controls aging. These genes are called sirtuins, and there are 7 of them in our bodies. And what they do is that they protect all organisms from deterioration and disease. Then we found out that resveratrol is like the accelerator pedal for sirtuin genes and stimulates NMN to make NAD, because sirtuins don't work without NAD. We also found that by the time you're 50, you only have half the level of NAD. Well, that's the people they observed, that you had when you were 20. When you give resveratrol to mice, we found that they lived longer and were super healthy. And this is from Dr. David Sinclair. By using resveratrol to increase NAD levels, it can influence a myriad of cellular processes, including mitochondrial, biogenesis, transcription, and organization of the extracellular matrix. Chapter 8, Aging and Age Reversal. No dietary means can achieve this level of restoration. However, dry fasting activates the cellular and autophagic repair systems that can demethylate DNA and furthermore target weak and damaged cells for removal altogether. Chapter 9, Restoring Youth. If you eat every day of your life, deep system repair isn't activated and bad outcomes become inevitable. Chapter 10, Endogenous Stem Cell Therapy. It takes 3 days of dry fasting to turn off all insulin production in the pancreas because only then is there no glucose in the blood system. pKa is an enzyme created by a gene that prevents stem cell activation. pKa is only turned off after all glucose has been exhausted and insulin levels are severely reduced. Fasting for longer than 48 hours switches metabolism to a fat and ketone bodies-based catabolism after glycogen reserves are depleted, thereby reducing IGF-1 and pKa. After entering ketosis, it only took 24 hours of fasting to reverse the age-related loss of stem cell regeneration and intestinal wall crypt stem cells to restore the gut wall. Dry fasting for 7 days or longer gives all the adult stem cells the time needed to wake up and divide enough times to flood the system with progenitor cells. It's an exact tissue match compared to the risks taken with using donated umbilical cord blood. Whoa. A baby is born without an immune system. It takes up to 2 years for the immune system to fully develop, and that's why a baby needs to be breastfed. A baby ingests the mother's immune system to stimulate its own immune system. Chapter 11, Telomerase Activity in Stem Cells. The idea of discovering how to achieve functional immortality is entirely dependent on the ability of endogenous stem cells to provide a dramatically longer cell life after replacing old cells. It would make no sense inserting cells that don't age well during tissue remodeling. Pluripotent stem cells exhibit high telomerase activity to maintain their extremely long and stable telomeres. There is a readily available source of pluripotent stem cells perfectly suited for radical life extension, released at the beginning of a dry fast. The best source of stem cells to initiate tissue remodeling are the ones released first. Muse AT stem cells from your own adipose tissue. They are released into the bloodstream on day 3 of a dry fast when pKa levels drop. Every cell that is replaced by a Muse stem cell is therefore immortal. Chapter 12, Muse AT stem cells. Pluripotent stem cells are unique because they can immediately differentiate into any type of cell, even nerve cells. They propagate at a rate second only to Wharton's jelly from umbilical cord stem cells. By periodically abstaining from food and drink for only a week at a time, the body can rejuvenate cellular function to restore youth. Chapter 13, the Phoenix Protocol. Your initial dry fast should begin, as Dr. Chenikov recommends, with a 1-day dry fast, then gradually increase the number of days as your confidence in the method builds, until you can complete 7 days. Dry fasting is not indicated for the following conditions: cirrhosis of the liver, gallstones, bladder stones, vein clotting, enlarged and twisted, often appearing as bulging blue blood vessels that are clearly visible in the skin, varicose veins, and blood clotting disorders. I'm assuming something like thrombosis, but I don't know. Okay. You will not get the full benefits if you do not complete at least 5 days of fasting and ketosis, but if you continue to the 7th day, the repair phase will be greatly enhanced. If a chronic illness is not eliminated during the course of a first dry fast, it's possible to repeat the course again in a month or later after the full exit from the previous course. And I'm not going to read all this, but the Phoenix Protocol, as he explains it, you take supplements with it. So, okay. Carrying out water procedures is a must. It's advisable to take a cool or cold shower morning and night to moisturize the skin. The counterflow of water through the skin is essential for helping the lymphatic system to flush toxins. Make sure no water enters your mouth. Refeeding syndrome is when too much food or liquid nutrition of specific types, protein shakes, banana smoothies, etc., is consumed during the initial 2 to 3 days after a fast. The period recovering from fasting should take as long as the fast itself. The second critical post-fast rule is to not consume sugar in any form. And it mentions like 0-calorie drinks, sugar substitutes like Splenda, fruit juices, grape juice, carbohydrates in general, because they can cause spikes in insulin resulting in rapid weight gain. That's what he says. And he mentions things to do after a fast. I won't go into that. Since you have created brand new baby skin cells, you have to treat them as such and protect them from the sun. Wear a hat and protective clothing for at least a month until your skin cells are strong again. Don't lay out and get sunburned. Chapter 14, Feeding New Stem Cells. I didn't see anything in there that was interesting. All right, well, that's it. Again, don't take any of this as suggestions or recommendations. But this was written by somebody who was a former NASA space station ops system engineer, chemist, and physicist. So he was working on kind of travel to Mars and the radiation that astronauts could endure during that trip. So this guy's no joke. And he's helped people heal from multiple issues like Hashimoto's and leaky gut and loss of smell. So psoriasis, all these things. If you're interested, do your own research, get the book. It has a pretty detailed protocol. Most of it I'd outlined, but if you want the particular details, especially day by day, I strongly recommend you get the book. Most people that I've seen doing dry fast, or that I've heard report doing dry fast, have been doing kind of hard dry fasting, where they don't expose their skin to water. And it seems really extreme. And so this is the first time I've actually seen anywhere where they recommend exposure to water. And it makes sense. After reading this book, I did a 24-hour dry fast, and from my experience, it was actually easier than water fasting and even liquid fasting. And I've done it for 2 days, not 2 days in a row, but I've done it twice, so once every week. Be careful and don't take any of this as advice. You're responsible for your own decisions in your own life, okay? But it's cool. I've never heard anybody fasting like this anywhere else before. So, good stuff.